Hi, everyone. This is Madison Lightfoot from Senator Shaheen's office. Thank you for bearing with us while we let everyone in. And we will get started in just a minute. It looks like a few members of the press are joining now. So thank you all for hanging tight as we get started. Well, it looks like we are all here now. So thank you all so much. Like I said, my name is Madison Lightfoot. I'm with Senator Shaheen's New Hampshire office, and thank you all for joining. Before we get started, I'm going to go ahead and go through a roll call of who we have on the line, both participants and press, and then I will hand it over to the senator. We have Dean Christon from New Hampshire Housing Finance Authority, John Manning from Southwestern Community Services, Melissa Hatfield from the New Hampshire Bureau of Housing Supports, Carmen Lorentz from Lakes Region Community Developers. We have Jeanne Robilard from Tri-County CAP, Katy Easterly Martey from the New Hampshire Community Development Finance Authority, Mary Sliney from The Way Home, Elissamargolin from Housing Action New Hampshire, Josh Meehan from Keene Housing. We have Betsey Andrews Parker from the CAP of Stratford County, Michael Reinke from the Nashua Soup Kitchen and Shelter. He is not on yet, but will be joining us shortly. And Ellen Groh from the Concord Coalition to End Homelessness. In addition to those participants, we also have a number of press on the line. We have NHPR, WMUR, the New Hampshire Business Review, the Caledonian Record, the Concord Monitor, the Union Leader, Salmon Press, Manchester Public TV, Laconia Sun, and the Nashua Telegraph. So thank you all so much for joining. Before I hand it over to the senator, I just want to make a quick note that we do have a limited time together today. So if folks could do their best to keep their remarks to 2 to 3 minutes, that would be appreciated. And with that, I will hand it over to Senator Shaheen.
Well, thanks very much, Madison, and thank you to all of you for joining me this morning and for what you're doing every day to try and address housing and homelessness issues in the state of New Hampshire. Let me recognize, in addition to Madison, Sarah Holmes is listening in on the call. She's my state director. Robert Henson is on from Washington, who has worked on a lot of these issues as we were doing the last COVID package. Pam Slack from the Keene office is on, and Alan Rodriguez, who is part of our communications team, is also on. So hopefully between us, we will be able to answer your questions. And as I'm sure, I think the last conversation that I had with some of you, it was about our efforts to get another round of COVID relief back in December when things were looking pretty desperate, and it wasn't clear at all that we would be able to get another package. I'm pleased that I was able to work with a bipartisan group to try and come up with a package that I think helped prompt leadership, both Republican and Democrat, and the White House to get back on board and get something done. And so we were able to get another COVID package, which was delayed a week or so because of the president's actions, but it is being implemented now, and we're really on to hear your concerns as you're looking at that, things you think we ought to be thinking about in the future as we're trying to address future needs. I think we all believed as we were trying to put together this current round of COVID relief that it was going to be short term to try and bridge the next couple of months to get through the new administration and get the new Congress started, in hopes that we could then revisit some of the needs and address those in a much more expansive way. So that's one of the reasons I really wanted to talk to all of you this morning. We got $25 billion for rental assistance for housing. We were able to extend the eviction moratorium for 1 more month. I think many of us believed that it should be longer than that, but we were not able to persuade our colleagues of that. And there are a number of other provisions in the package that hopefully will help some of those people who are really struggling with housing costs. There's an additional help for the SNAP program, an 15% increase in the benefit amount under SNAP. There are additional nutrition programs that are funded. $13 billion for nutrition is in this package. There's additional help for childcare, about $10 billion to help with childcare. Of course, the unemployment benefits have been extended to mid-March, and an additional $300 a week added on top of those. So there are some other provisions that I hope will help those people who so many of you see really struggling these days. And hopefully we can, as we're thinking about another round, we can address some of the other concerns that you have. The one other piece that I wanted to point out that I heard from so many of you throughout the summer and fall was we need to get an extension of the deadlines beyond December 31st. That has been included, as I'm sure you all know. It's been disappointing to me that the state of New Hampshire has chosen not to take advantage of that extension in some areas, because I think the state could have used some of those dollars that were not expended, particularly the help for rental assistance that the CAP agencies were administering. That would have been very helpful to people. And it's disappointing that that has ended despite the extension in the deadline. So again, thanks for joining me, and hopefully we can answer your questions, and really appreciate the comments and the input that you have for us. Madison, I'll turn it back to you.
Thank you, Senator. With that, we will get started with Dean Christon from the New Hampshire Housing Finance Authority.
Thank you, Madison. Thank you, Senator, for taking the time to do this and for your continued support for housing related issues. We really appreciate it. I want to thank you in particular for the support for the emergency rental assistance work. As you've already noted, I think that's going to be a critical resource and program as we go forward. And I also want to note something that is not as visible to people that was in the package, which is, as we've talked about for many years, the fixing the 4% credit for the tax credit program. Longer term, that's going to be very valuable in terms of building more affordable housing. It actually will add some really significant value to our ability to create additional affordable housing stock. And while that won't be an immediate solution, long term, it's going to be very valuable. I would suggest a couple of things really that for consideration as we go forward, as you mentioned, for additional resources. One, I think one of the things the pandemic has really pointed out is the critical need, not just for more affordable housing generally, but specifically for supportive housing, particularly for people who are at risk of homelessness. And while, we have some resources, and we're going to work soon with our friends at CDFA to roll out some of those resources to help create more of that kind of supportive housing. Additional funds for that are a really critical priority, I think, as we go forward into the budget process and the additional stimulus resources that might come forward. We really need to work hard with many of the partners around this call and others to help create more permanent supportive housing throughout the state to really reduce the risk to that really critical population. And then the other piece that I'll just add here is that there's been a lot of focus, I think, on rental assistance and appropriately so. And a lot of work was done early on to provide forbearance opportunities for people who are homeowners. But some of that is going to start moving forward now. We're starting to see some people coming out of forbearance. And I think we just want to make sure we're focused on how well those programs end up working and whether there are people that are at risk of losing their homes. And so as you look at future stimulus resources, it may be necessary to put some dollars aside for housing counseling activities, for actual intervention to help people from avoiding foreclosure. I know that Senator Reed's original bill, which I know you were part of, kind of covered a broader range of things. And in the end, it kind of ended up being focused just on rental assistance, and that's important. But as we move into the next phase, I would hope we could look at the possibility of maybe making some resources available to homeowners who may be at risk when this all works out in the end. The economic impact on lower income homeowners is really quite significant. And some of the forbearance strategies will help. Some of them ultimately may not in the end for some of those individuals.
Well, thanks, Dean. I really appreciate that. I was talking only about the COVID package, but we also at the end of the year passed a significant omnibus appropriations bill to continue to fund the government, which increased a number of programs within HUD that can help. I don't think that was one of them, though, that got increased. Do you know the answer to that, Robert? The counseling piece?
There is some, and I can pull up the summary. There is some money for both counseling, neighbor works, some of the other, housing, homeowner associated programs. But I do think it's important to set some aside specifically for that. And I'll have to go back and look at the summary of I will just say that the overall THUD appropriations bill for fiscal year 21 is quite strong, and a lot of the accounts were plussed up, and or some of them are at their highest level ever. But I'll have to check on.
I certainly agree with that, and I appreciate that, Senator. I think there was certainly, you all heard that there was a need here, and that budget is much stronger than it has been of late, and we appreciate that. So thank you for that as well.
Well, thanks. And I know that, at least from my perspective, that we have had some challenges with HUD with getting the funding out in a expeditious way to all of the agencies, to the states that really need help. And we will be staying on that, as you point out, and as Robert has said, there is additional money in many of these programs that HUD administers, and what we need to make sure. And I appreciate that there's a transition and the new administration is going to take some time to get up to speed, but we want to do everything we can to make sure that the money gets out there to provide the help that people need. So
actually, for that specific question, the housing counseling account was plussed up to $77.5 million, which is $25 million more than in FY20. So it's not insignificant, but
good.
Thank you for that. And also, I appreciate the fact that your staff has always been very supportive when we've asked for help with flexibility and engagement with HUD on trying to move things along. And we do appreciate their responsiveness.
Well, thanks. And stay in touch with us as you're seeing things get rolled out, so that we know what's working and what's not.
Thank you. And I'll be sure not to overtake my time. So thank you, Madison, as well.
I know Madison has a hook, so she's just going to darken everybody's screen.
We'll cue the music as necessary. Thank you, Dean. Next up, we have Melissa Hatfield with the Bureau of Housing Supports.
Sorry, I had to unmute in two spots. Good morning. Thank you for this opportunity. I don't have any questions or major concerns at this point, just to thank you for the new housing funding that is coming out. I know the timing of the housing relief program ending and the start of the new funding has been a concern for a lot of people. I'm fielding emails about that around the clock. And it was a decision that was made at some other level. So we're just doing what we can to get the new money up and running, and tapping into some of our existing funds to fill some of those gaps in the meantime. So we are watching this very closely and doing what we can to try and make sure we're meeting the needs of the folks out there. That's all I have. Thank you.
Great. Thanks, Melissa.
Thank you, Melissa. Next, our friends at the CAP agencies are going to go together to provide a joint update. And first will be John Manning with Southwestern Community Services.
Thank you, Madison. Good morning, Senator. Again, thank you for all you've done for New Hampshire, the CAPS. Two things I think I want to start the conversation with. First of all, an update on how things are going with our shelter programs in this part of the state anyway. Our shelters are almost consistently full, are almost consistently full. We've had the decompression shelters that have been set up, which were really critical to be able to spread the shelter population out and make for a much healthier environment, certainly if we did have folks that became sick or thought they were sick. The concern from that perspective is that the funding for those decompression shelters continue. I think that what we can't do is decide that as we start to come out of the pandemic, they're not needed anymore. I think that they've provided a lot of service, including the fact that it's just not it's an unhealthy way for people to live when we're putting a lot of people into, large number of beds in a room just because they're in a shelter. So being able to spread that population out is just better in general. My concern is as we start to recover from this pandemic, a lot of our folks were the ones that suffered the most and will probably take the longest to recover. And so I just don't want it to lose, like we're all right, now we're ready to go forward. So continued funding for the decompression sites. And then echoing what Dean said, I think supportive housing and supportive services. No matter what we do when we meet with our consumers, we know they have needs, mental health issues, physical health issues, substance misuse disorder, and there are not enough services out there to serve them. So I think that's an ongoing conversation, I know, but just something we don't want to get lost as we try to get through this COVID part of it. The housing relief program, I can give you a quick update on how we did. I know there were issues with it closing at the end of the year, and I think, as Melissa said, that was certainly a decision made above the CAPS level. And what we did is we worked real hard, and as of last week, we had issued more than $12 million in assistance. Over 4,000 applications were processed. There was a lot of frustration on the part of the CAPS. Because due to the way the program was set up, it was difficult at times to get that money out as quickly as we want. Everybody that applied as of December 18th, our expectation is the applications will be finalized and they will receive assistance, but it was shut down at that date. We are waiting to go forward with the new program whenever the state works it out. And I know they're waiting for Treasury to determine a lot of what Treasury is going to be looking for nationally. So that's a quick update on the HRP program. And I don't know, Betsey or Jeanne is going to go next and fill in some more blanks for me. But again, thank you. And also, Senator, and I know you know this, your staff is the best. They are responsive. Whatever we need, we're there. They're there for us, and we really do appreciate it. So thank you.
Well, thanks. I really appreciate that. I know that the staff works really hard, and it's like for all of you and for all of the people we all represent, it's been a difficult year for everybody, and hopefully 2021 is going to get better. Can I ask, Betsey, maybe you can address this as you're talking about the Housing Relief Fund. It's my understanding that only 20 million of the 35 million that was allocated was actually used. Is that 15 million rolled over? Melissa, maybe you can answer that as well. Is that rolled over into the new program, or do you know where those dollars have gone?
I'm gonna punt to Melissa.
Yeah, I can speak to that. It was recouped by the Gopher office, and they did something else with it. I was not part of the planning for what they did with the rest of the money. We pushed really hard to keep it, but they took it back.
Okay, thanks. That's helpful. So,
do you want me to go?
Yes.
So, Senator, thanks so much. And also, you were amazing on the floor last week after everything that had happened. So thank you for everything that you're doing for us. And I'm glad you guys are all safe. Echoing with John, I think the one thing I think that is really amazing about all the work that you've done at the federal level is looking at the number of partners who are here. And then in Stratford County, we have been working and we set up an emergency shelter at a local hotel, which we have determined has kept that hotel in business, which I think this is a subsequent thing as far as also keeping their jobs. And then that would not have been possible if it wasn't for Melissa Hatfield, Katy Martey, and where's Dean? We've used all of these resources to come together, and that the way that we have put this housing puzzle together for decompression of COVID has been amazing. And so this would not have worked if the work that we do locally, if it wouldn't be for these amazing partners that we have. So the flexibility that you have is great. And then how you followed up with the federal legislation to be more specific to address the needs that we've talked about in regards to landlords not being, when landlords don't respond to us for any program, whether it be fuel assistance or rent assistance, whatever it is, there's not much that we can do. So the fact that those changes have been made, giving us that allowance, is going to help so many more people. So thank you for hearing that and advocating for that. I just also want to point out that when, lots of things have shut down during this time, and it's been very challenging for local spots, but we have been able, again, thanks to the funding that have come to their various partners, we've opened up a day center where we have seen over 101 unique individuals. There's no more restaurants to hang out in. There's no more libraries to go to, all those things for people who are unsheltered. But because we've had this funding and because we've had partnerships, we've sent 10 people to get substance use disorder treatment. 19 people have been referred into permanent housing, which is the rapid rehousing and other funding that we've had. We're doing things like helping people work through and get their licenses so they can get into permanent housing or get what they need. And that we're doing that because of the funding that you have and the flexibility. And so I'm just saying that this is working, but those services, because of COVID, are being impacted all around. And we're still working, but if there's anything that we can do with more vaccine and rollout, I don't know what we can do, because we are shelter providers. This is not your fault. This is not anyone's fault. Yeah. We've got to get the vaccine out to where our critical infrastructure is. We just had to shut down after we did all that, we shut the day center down because we had COVID positive people. So for 3 days, people can't get services. We need to get vaccine out. Otherwise, we can't continue to do this great work that we're doing. So whatever we can do on the vaccine level would be appreciated. I know you're advocating for it, but.
Well, thanks, Betsy. And as you know, it's a challenge for you all and in so many areas in New Hampshire. And I know that the state is working really hard. And one of the challenges is just the amount of vaccine that's being distributed to states. And one of the frustrations that I have is that because we're a small state, sometimes the formulas are not as helpful to us as some of the larger states. And so we're working with some other small states to try and address that so that the resources are here with the vaccine to make sure that the funding to administer it and that the help gets out to people. So I had a call yesterday with a number of folks who are in the healthcare community and heard a lot about the challenges they're concerned about. So we're going to keep working on that and recognize that it's an issue beyond, it's an issue that affects everybody, regardless of where you are and what you're doing. And so thanks for reinforcing that.
Thank you, Betsy. Next we'll go to Jeanne Robilard at Tri-County CAP.
Hi, as the last on deck, I don't have an awful lot to add that you might find helpful, Senator. One thing I will say about our rural area is, we've always had an issue of emergency shelter, people showing up, it's 20 below, and there's nowhere to put them. So having, more dollars available for that type of immediate solution is helpful to us up here. As we look for, more permanent solutions and the rapid rehousing dollars. And, also one of the things that I can say is that, along with my fellow CAPs, none of us have shut down any service or any program for a single day during this pandemic. And it's hard for staff. It's hard on the staff. The helpers taking care of everyone who needs help. And I know one of the things that was nice, not just financially for our staff, but the recognition for the work that they were doing was funding streams that came with a little bit of extra incentive for them to help them, stay at their job and feel valued for the work that they're doing. So that's, just if you can just sort of keep that in the forefront, and it helps us, to not lose people either. to the pandemic.
Yeah,
for
no,
variety-
that's an important point, and I was pleased to see the state step up and provide some of those additional dollars. I think that was really welcome.
It was very, very helpful. Anyway, and thank you for the work that you're doing. Just so proud of all you do for our Granite Staters.
Thanks, Jeanne.
Thank you. Next, we'll go to Carmen Lorentz at the Lakes Region Community Developers.
Good morning, Senator. Thank you
Hi,
for
Carmen.
doing this call with us. Glad that you guys are safe, and echo my deep appreciation for all the work that you've done for housing. I just want to build off of a couple of things that I think both Dean and Jeanne just mentioned in terms of the supportive housing piece. One of the concerns that I have going forward is in our area and probably in other rural parts of the state, we don't have the same infrastructure of supportive housing and services to deal with the increase in homelessness that we've experienced. So we're really kind of struggling with that right now in Laconia and the surrounding areas. We're very interested in developing supportive housing and using the tools that are being provided by New Hampshire Housing, which is awesome, but it's really challenging because we don't have the same concentration of service providers. It's very challenging to staff, to find an organization that can actually staff these supportive housing projects, because that's not something that we know how to do. And so we're really relying on partnerships. So I don't know what the solution is, but I know that's an issue in other rural parts of the state as well. And I think my concern is just we don't have the capacity to absorb a lot of the COVID funding that may be coming into the state. So we may have to miss out on some of these opportunities because we haven't built that infrastructure. But I think what that's taught us is we need to have it. The homeless situation has been growing regardless of COVID. We've been struggling with this issue for a number of years, and it's gotten worse under COVID, but it's still an issue that I think is going to be with us for the long term that we have to figure out.
So Carmen, I'm sorry to interrupt, but before you go on, can you talk a little bit more about what aspects of the infrastructure that are most needed?
Well, I think the piece that's missing is funding for staff. So we're talking with service providers about, okay, what are the barriers that your clients have? What kind of housing do you need for your clients that require permanent supportive housing? And they know what's needed. They don't have the capacity to staff this additional facility that we could build for them. So I think figuring out some operating funding for organizations that, mental health, substance use providers that they can use to staff supportive housing facilities would be a huge help for us, because that is the big issue that I keep running into when I'm seeking out these partnerships.
Thanks, that's helpful.
You're welcome. That's all. I just wanted to highlight that and say thank you for all your great work.
Okay. One of the things I will point out, and Robert or Madison, you may correct me, but in the COVID package, we did include funding, some additional funding to help address the opioid epidemic, and again, continued the flexibility for what could be covered, and also included additional funding for mental health. So again, not as much as I had hoped, but there is some additional funding. We tried to include more money for the state opioid response grants. And while there is about $1.5 billion in the omnibus appropriations bill, the additional funding we had hoped to get in the COVID package didn't happen. But there is, those programs have been plussed up. So we should look there, Carmen, and see if there's help for some of the concerns that you're raising.
And this is Robert. I'd also put in a plug for the through the Support Act, the funding that was there was initially $25 million in FY20 that Senator Shaheen specifically requested and was granted, and I think there's another $25 million in. And Katy Easterly Martey, you might want to talk. It's basically CDBG money. I think the state of New Hampshire gets about 1.2 million, both FY20 and FY21 for supportive housing, towards supportive housing for people with substance use disorders. And that's, like I said, CDBG money, which is pretty flexible. I don't know the exact parameters and whether it can be used for operating expenses or payroll for service providers. But that's another thing that the senator was instrumental in trying to help address some of these concerns.
Yeah, we ought to check that to see if it can be used in that way, because that might be really helpful.
Carmen, we can take a look at that and follow up to get you additional information about the Support Act funds. And I'm sure Katy will also speak to that. And next up, we can go to Katy Easterly Martey at the CDFA.
Great, thank you. I want to echo my thanks. And I'll start just with talking about the Support Act. We're excited about the flexibility that is part of the Support Act. But I think in exploring further how we can use those dollars to really identify, or not identify, I think the needs are really identified, to really support those needs, particularly in our rural underserved communities. These are funds that are only for a temporary, so they need to be expended. 30% of the funds need to be expended in the first year. So while we would be able to use them as an operating subsidy, they would only be able to be an operating subsidy for a short period of time, needing to then be able to sort of bridge them into a longer term subsidy for that operating support. Because when we build new permanent supportive housing units, we often use other funding that requires a longer affordability requirement. So it comes with a 5, 10 or longer year period in which those units need to continue to serve people. And if we provide operating subsidy only for that period of the Supports Act with the supports dollars, there would be this cliff in which service providers wouldn't have funding to support those services. So we've been working with HHS to identify whether potentially there is an availability of the Medicaid support dollars that could, so this could be a bridge. They're working on that amendment to the Medicaid allowable uses of funds that would allow these services to be provided through that 1915I waiver. And so it's possible the supports dollars could be a bridge between when that waiver becomes in place to be able to pay for support at this time. But one of the challenges that Carmen still sort of does speak to, and I think that we're really struggling for how to identify, is that I think more than 80% of those people who are housed in New Hampshire in recovery housing are actually housed by individual operators of recovery houses. So this is an individual house owned by somebody and operated as recovery housing. And even the flexibilities that are provided in this act will be difficult for those individuals to meet. And then as Carmen said, those other operators, like in her region, Navigating Recovery, which I know she partnered with to be able to create some permanent supportive housing, they have very limited capacity to build out additional units and then to weave together these fundings to be able to have funds for the supports that are necessary to support the people that are living there. So I think it really is a capacity building issue, and we're working in partnership with HHS to really build out that capacity, but it takes a long time. And we'd encourage just additional funding for the Supports Act, because if we build that capacity, we want it to be able to be built out in a way that it takes for capacity to be built, particularly in our rural communities, which is often slowly by adding a 5-unit additional property and then slowly building into something else and building out the capacity, for instance, to be able to build Medicaid through the 1915I waiver. So just encouraging kind of, it usually we've seen takes between 5 and 10 years to have stability in these organizations to be able to run this housing. So if we could just encourage, even if it's not a lot of money, the continued support of this Support Act's funds, it would allow us to just get to places that are currently underserved with permanent supportive housing. And
yeah, that's really helpful, Katy, as I'm sure all you and everyone knows, to get legislation that includes more than just a couple of years to help with operating and capacity building is I have found to be one of the most difficult challenges in persuading colleagues to support those dollars. People are much happier to put in initial funding and then to say, after that, you're on your own. And of course, that creates real difficulties, particularly where, as you point out, we don't have that capacity for follow-on. But when you say HHS is working on the Medicaid bridge piece, is that New Hampshire HHS or is that federal HHS?
New Hampshire. So we're, there's a number of states who have already done this, but I think less than 20. And so we're advancing that at the New Hampshire level.
Great.
That's actually something I'm working on at the Bureau of Housing Supports. We're like this close to submitting our state plan amendment for these services.
That's great.
The other thing, and this is somewhat connected actually, we've, I think everybody on the call has mentioned the need for permanent supportive housing has increased in the pandemic, but some of our partners, and we're not sure about HUD's interpretation, are interpreting the connection to COVID very narrowly. So suggesting that people really need to have that, for instance, creating permanent supportive housing is not a response to COVID, when indeed we know that particularly the most vulnerable people are in such worse physical conditions, their increase in homelessness has been. And so just the need to create sustainable solutions and not to do things that are temporary for the sake of meeting the act and not the needs in the state, and just encouraging just that guidance if it could be provided, because we know that there's just been a narrow interpretation, and we appreciate working with Robert and your staff to really help us through those when it can be interpreted more flexibly. But we've definitely been seeing a kind of narrow interpretation, and we're concerned about that.
Well, for sure, let us know where there are issues of concern so that we can get on them early as we're starting the appropriations process again, as we're starting another round of COVID relief. The more insights we have into what you think are concerns, the better.
And I know I'm probably out of time, but one last thing, just we've really seen, and you mentioned this, and it's so hard to fund, we understand, but housing and housing solutions are really done at the local level. And we've seen some great examples of where communities are coming together, like in the coordination for emergency preparedness in the Lancaster region. I know multiple regions who had never worked on emergency solutions together worked together and they had to because of the pandemic. They didn't have enough resources doing it alone. But we're concerned about just the ability to take those lessons of partnership and bring them forward into their future work for the recovery are being stretched by the financial instability at the local level. And so I think there's just a real, in terms of, I know it's been really difficult to think of how to support sort of local property tax reductions and sort of revenue, but just saying that really is carrying over into some of the lack of housing solutions, because as the very limited, particularly in our rural communities, local government officials are working on these sort of revenue challenges, they're having less time, we've noticed, to really be thinking of advancing important sort of recovery efforts. So just encouraging continued support for local government and the revenue loss that they've had.
Thanks. And I think one piece of good news is that, assuming he gets confirmed, the new Agriculture Secretary, Tom Vilsack, has done this before, and he really appreciates the need to support programs that help in rural areas. And he has a much more expansive view of what ag can do beyond just supporting crops. And so I think that will be good news as we think about the coming months.
Thank you, Katie. Next, we will go to Mary Sliney at the way home. I just want to do a quick time check. If folks could keep their remarks to 2 to 3 minutes, that would be really helpful. Thank you so much, and I'll hand it over to Mary.
Thank you. The Way Home has been one of the players with homeless prevention, rapid rehousing funds, and both through HUD and some state dollars for eviction prevention. One of the challenges, I think, is the engagement with landlords and tenants, and being sure that each one is doing their part while we help to relieve the stress by assisting with back rent. We're also challenged with assisting with the increased homelessness. Manchester has certainly been in the news, and it's been the experience of the decompression in the shelter, the folks who are afraid to be in the shelter, and so many folks in tents. So trying to get people into permanent housing with such a limited supply of housing has also been one of the challenges. But any additional help that can be made for educating landlords in terms of working with the community resources and facilitating the process with them is what we're looking for with our partners.
And do you have a suggestion of something that's worked well in terms of working with landlords?
I think the one of the resources we have had has been part of housing counseling. And when they know that tenants are getting educated on budget and financial management strategies, and also taking care of their unit as their home and landlord communication. So when we're able to get that message to landlords that part of the deal is the rental assistance, but also the education of the tenants, we've gotten more cooperation.
Thanks. So it goes back to Dean's point in the very beginning.
Thank you, Mary. Next, we have Elissamargolin at Housing Action New Hampshire.
Hi, good morning, Senator.
Alyssa.
Hi, everyone. I do want to also share my appreciation, particularly for the central role you played, Senator, in the bipartisan group to make sure we had another relief bill. We are really pleased with the rental assistance package, and also, as Dean noted, the inclusion of the 4% low-income housing tax credit, keeping our eye on production as well. I will say that so many of the agencies represented here have worked so hard to get these resources out the door to the people who need them. Dean's team, Katy, Melissa, all of the CAPs. We look forward to working with them on all the lessons learned and being as efficient as we can with the new rental assistance in particular. As you know, this package comes with some incentives for states to spend the money. And there is a clawback provision for states who have not spent enough of the resources. Starting in September, there is an extension request. So we may be working with your office at that time and would like to keep you posted on how things are going and how we end up rolling out this program. But I know that there are so many lessons learned and a lot of efficiencies that were created through the coronavirus relief funds. I do want to share some good news. Some of the resources that you helped secure for us in the last package were used to stand up a statewide testing program for our homeless shelters. We did that through a partnership with UNH and kept DHHS up to date and got their support for that. And that is up and running as of mid-December. And we can provide weekly testing, and it is open to other shelters as well. And some of that funding to start that program came from the coronavirus relief funds and is now funded through the Community Crisis Fund from the Charitable Foundation. I realize that the vaccination planning is taking place at the state level, is not necessarily a federal level, but we do have some concerns because homeless shelters were initially identified in all of the initial drafts, the initial plan. However, they were pulled out in the final rollout of the vaccination prioritization. So Housing Action New Hampshire will be increasing our advocacy because it is unlikely that shelter guests and shelter residents will go to standalone sites. If we're really concerned about the public health as a whole, we need to make sure we have a plan to get vaccinations to them and to the staff on site. Incarcerees and the disabled and other congregate housing, they were included, but we're concerned that both subsidized senior housing and homeless shelter guests are not currently included. And with that, I'll wrap up my comments and thank you once again.
Thank you. I would point out that there seems to be agreement now among the outgoing Trump administration and the incoming Biden administration about expanding how the vaccines are distributed, and including the new guidance is everybody over 65, regardless of location. So I know the state is still trying to figure out how that is going to work in the plan, but hopefully that will bode well for addressing the concerns that you're raising.
Thank you, Alyssa. Next, we have Josh Meehan from Keene Housing.
Hi, Josh.
Thank you, Madison. Good morning, Senator. There's a lot of common themes here, one of which is how do we make some of these things permanent? And I think housing authorities are experiencing that same feeling, particularly, I have to give credit to HUD, Public and Indian Housing staff. I think they took the direction from the CARES Act very well, and they provided us a great deal of flexibility at the Public Housing Authority level, which we would really like to see made permanent. I think what we see is when the chips were down, HUD said, okay, let's let housing authorities figure out how to do this the best. And I think that's been proven to be a good approach. And we hope that when there are opportunities in the future to make some of these flexibilities permanent for PHAs, that you would support those efforts. And I just wanted to give you one example. So on the funding side, they gave us great flexibility on how to use the CARES Act money. And for us, we've used that to help 120 families have access to broadband at a time during which our schools are shut down. So the kids are getting laptops, but if they don't have reliable broadband, it's not that helpful. So I just kind of wanted to call attention to that and give you a real life example of how that flexibility has been helpful to us. And another sort of silver lining in the CARES Act was some new vouchers. And so there's been a lot of talk this morning about how a lot of the solutions are temporary, but one of the permanent solutions that was embedded in the CARES Act was an expansion of the mainstream voucher program. And the mainstream voucher program serves disabled households who are homeless or at risk of homeless, institutionalized, or at risk of institutionalization. And we've received a number of those vouchers. They're competitive. They were put out competitively, but HUD made it pretty easy to go after them. And we've received 25 in the last tranche. And that's helped. For example, we are working with John and his folks. They're making referrals to us, and we're helping to get vouchers to folks who otherwise might be in the shelters or staying in the shelters longer than any of us would like. So any opportunity that there might be to add some additional vouchers in the next package, whatever that might look like, I think that's a real great opportunity for us to provide permanent affordable housing to folks who are more at risk because of COVID for extended periods of homelessness, et cetera. And I would also echo that the having resources available for supportive services for those households, which we don't receive any housing authorities don't receive any funding for supportive services really at all. We would appreciate if our partners were able to be better funded, to have long-term operating covered so that they could increase their staffing to provide longer and deeper assistance to those households we serve. I would also echo the appreciation for fixing the 4% LIHTC. That's going to be a real great tool for us. We just finished a 4% project right here in downtown Keene and look forward to doing more in the future. And then just finally, I've worked in a few states at housing authorities in my career, and I just want you to know that your staff is by far the most responsive and easy to get to and most engaged of any that I've worked with. So thank you so very much.
Thank you. I'm glad they're on the call so they can hear you say that.
Thank you, Josh. Next, we will go to Ellen Groh at the Concord Coalition to End Homelessness. We do have 2 folks left in just a few minutes, so thank you all so much. Ellen?
Great, thank you. I'm going to just echo the thanks to you, Senator Shaheen, and Madison's just been incredibly accessible and helpful to us in the Concord area. So thank you both. I'm going to echo everything everyone said about permanent supportive housing and making those dollars for the supportive services easily available. It's very hard in the timing to even commit to a project when you don't know you have the supportive services, or to have the supportive services when you don't have the housing. They have to come together. And that's really hard for a small nonprofit to try to juggle that and have any leeway in filling a gap until something else gets committed. I want to also ask you to think about homelessness as a public health issue. I think that the pandemic has really revealed that fact, but I think it's been true all along. If you don't have housing, your health is in such jeopardy and everything else falls apart. So viewing it as a public health crisis and having the CDC become involved with the USICH, combining those two, making that part of the whole way that we approach homelessness as a public health issue, I think would be a great outcome from this terrible pandemic. And the timing of the funds, like we were not able to spend all of our housing rental assistance in the last round. And I don't think that was anybody's fault. People worked around the clock, but allowing more of that rental assistance funding to be used for staffing and supportive services to help the people get the money. I think only 10% is allowed right now. I'd love to see more flexibility so that we could reach the people. The people are out there and they need the rental assistance, but they need more assistance, and the CAPs need more staffing to be able to reach everybody. So that I'll cut it off there to leave everybody else time. Thank you.
Thanks.
Thank you so much, Ellen. And last but not least, we have Michael Reinke from the Nashua Soup Kitchen and Shelter.
Kudos to the staff as well. Just a couple of things just to mention again, with the Supernova Continuum of Care, if we can move the what are essentially the Section 8 vouchers into the Section 8 program, that would free up so many more dollars to do creative things with that Continuum of Care funding. And I would really, I mean, I know that HUD allowed for some Section 8 vouchers to go for above the fair market rent in terms of this COVID time. Continuing that, again, going up to 60% or something like that would increase the total market. We can, we're constrained by the fact that we can only rent with half the market, and that's impossible. And then also thinking about how we can allow some, creative uses of that. So one of the things that we've done in the last few months is that NSKS has rented. So if I'm a single adult staying in a shelter, I can reasonably, from HUD's perspective, move into a 1-bedroom apartment or efficiency. Even that becomes difficult. So what we've done is NSKS has rented a 3-bedroom apartment, and now we're subleasing that to 3 people who were staying in our shelter, but now each of them is renting a room from us. So the landlord has a guarantee of, we're going to be paying the rent, we're going to be responsible for the upkeep and keeping the apartment doing well, essentially providing case management support for the people staying there. And we're able to move single adults who otherwise would have had to say, how do I come up with $1,000 a month? Now they only have to pay $500 a month for a single room. Those kinds of creative uses, if we could have HUD thinking creatively, very helpful in terms of providing more housing solutions to people who are currently unhoused.
Yeah, that's a great idea.
Thank you, Michael. I will hand it back over to Senator Shaheen for closing remarks.
Well, again, thank you all for taking the time and for sharing your insights into what we can do better as we're looking at resources that you need and that all of your consumers need in order to get the help that will put them back on positive track, whether it's housing or whatever else. And I appreciate what you're saying about the housing being a public health issue and about the need for housing in order for people to get and keep jobs and relationships and all of the other aspects of housing that are just so critical. So appreciate your continued working with us, and of course Robert and Pam and Madison are all always ready to hear any ideas you have, any thoughts as we're starting this process up again for another round of funding to think about how we can make things work better. So again, thanks so much, really appreciate it, and stay in touch. Let us know how we can continue to help. And Happy New Year. 2021 is going to be a whole lot better than 2020. I am convinced.
It's hoping.
Yeah.
Thank you so much.
Thank you.
Thank you all. Take care.
Thank you.
Bye-bye.